So thanks everybody for coming. I appreciate it. Sort of a classic thing. I saw a guy in the office yesterday, a 52-year-old guy, and on my schedule it says, has a problem. It doesn't say elevated PSA or prostate issues or erectile dysfunction or something like that. It just says, has a problem. And that's key. So I sit down and talk to this guy. He says he hasn't been to a physician for 25 years. And we talk about the first thing that comes to his mind is his erectile dysfunction, which is obviously an important issue. And this morphs into testosterone issues and his prostate and a family history of prostate cancer, et cetera. One of my goals is to get people in early. For so long, I see guys when problems are a problem rather than prevention. And I think a big part of my goal when I see patients is about wellness and prevention. I think that's incredibly important. I'm also a big proponent of diet. Like Dr. Hilton said, I think diet is really one of the most important things. My wife is this militant vegetarian, and it kind of trickles down to me. I have to kind of go downstairs when she's asleep and sneak a piece of salami or something like that. But in truth, a healthy diet is a cornerstone to good health. And I see so many people who really neglect their diet, and I think it's really important to focus on the diet. Exercise, again, it's not something you don't need to train for a marathon. Regular exercise, I like to tell my patients, get your heart rate going, sweat a little bit. Get out there and do things, but it's really, along with diet, something that's incredibly important. Sleep habits and stress reduction. When I talk to guys about erectile dysfunction, they're all poor sleepers, and they all have this immense degree of stress. So getting yourself on a good regimen for good sleep habits and figuring out a way to alleviate some of the stress in your life is going to pay dividends long term. So let's talk about erectile dysfunction, erectile function. The first thing I want to talk about is erectile function. What do we need to get an erection? Simplistically, and erectile function is not a simplistic issue. It's a complicated process. But simplistically, we need three things. Blood has to get there and stay there. Get there and stay there. Both of those are incredibly important. The nerves have to work. And nerves are typically pretty resilient. And in many patients, the testosterone level has to be normal. The number one problem in men with erectile dysfunction is blood flow. So the way we're set up, we have two small blood vessels that go to either side of the penis. And in upwards of 30% of patients, there's only one-sided blood flow. And if those little less than 2 millimeter blood vessels get clogged with atherosclerosis, or you only have one side, you're not getting the blood flow you need. And consequently, when you do increase your blood flow with something like Viagra or sildenafil or Cialis or one of those medications, the blood doesn't stay there. It has a tendency to leak out. It's somewhat like turning your spigot on in your bathtub and not putting a plug in. You can increase that blood flow, but if it's leaking out, you're not going to maintain an erection. As far as the nerves go, nerves get damaged in patients who are diabetics and in patients who have had pelvic surgeries, typically prostate removal, rectal cancer surgery, and other processes like diabetes. Diabetes can attack those small nerves and create problems. The testosterone issue, and I'll get into that a little bit later, the one thing that I see a lot of in my office is patients come in with erectile dysfunction, and the first question they ask me is, do I check my testosterone? And the mindset is that if I'm on testosterone, my erections are going to be normal. And that's not necessarily the case, and in fact, most patients, it's not the case. So testosterone is important for many reasons, but in many cases, it's certainly not the linchpin. The linchpin is blood flow, and it's incredibly important to understand that, because men who have poor blood flow down here have poor blood flow to their heart and poor blood flow to their brain theoretically and potentially. I like to say that erectile dysfunctions or erectile function is a barometer of your overall health. If you have difficulties with erections, that's a sign that you have some health issues, so don't ignore that. And I'm a big fan of talking to all my patients. Somebody comes in with an elevated PSA or some urinary issues or a kidney stone. If I think they're at an age where erectile function is an important issue, I'll ask them about it. And 99% of the time, men want to talk to me about that. So feel free to ask and to talk to your primary care physician and to talk to us about that. I think that's important. So I like to term this cardiovascular health, because in essence, if you have erectile dysfunction, you are at higher risk of heart attack and stroke. There's a good study done that showed that youngish men in their 50s who presented to an emergency department with chest pain of cardiac origin, at least 50% of them admitted to having ongoing erectile dysfunction. This is a first episode of chest pain. 50% admitted to erectile dysfunction. So if you have erectile dysfunction, talk to someone about it. It's an important issue. Screenings and paying attention to symptoms are also a key part of this whole thing. So what about testosterone? You know, there's all this myths about testosterone. There's all sorts of, in the lay press, there's all sorts of things about how good it is and how bad it is and why you should be on it and why you shouldn't be on it. You know, the bottom line is that testosterone in my office is an important test if you have symptoms. That's the first thing you've got to have. And it's incumbent upon me to talk to you about those symptoms. Diminished libido, lack of energy, loss of muscle mass, lack of motivation, mood disturbance, loss of morning erections, some erectile difficulties. You've got to have those symptoms before we're going to treat you or even evaluate you. And then we're very cognizant about following up and following the American Urological Association guidelines. And the guidelines are important. Interestingly, if you look at the AUA guidelines, that's the guidelines established by our organization here in the United States. If you look at those, if you look at the Endocrine Society guidelines, if you look at the European Urology Association guidelines, they're all different. So in the AUA, I go by a minimum level of 300 nanograms per ml as being a low testosterone level. The Endocrine Society is about 275. In Europe, it's 350. So there's not consensus on this issue. Really importantly, though, you've got to have a low level, and it's got to be repeated. So you have to have 2 levels. I also get some secondary blood tests to figure out why the testosterone is low. And you got to have symptoms before we're going to treat. And then I think that when you treat men for low testosterone, you've got to treat them in a very systematic manner and make sure that you're following them appropriately. That means regular blood tests, regular checkups. Testosterone does not cause prostate cancer. It does not cause the prostate to grow. It does not promote cardiovascular problems. And that's all pretty well established. Lack of testosterone can promote some cardiovascular issues, we think, nowadays. So there's a lot of myths about testosterone. Make sure that if you're on testosterone replacement therapy, that you're being checked regularly and that you're having typical and regular follow-up. So what about the prostate? You know, there's 2 broad categories of prostate disease, cancerous and non-cancerous. And they don't really cross over. I tell patients that prostate cancer doesn't cause symptoms. So if your PSA is elevated, and that's an hour-long discussion. But if your PSA is elevated, you can't look at me and say, I don't have any symptoms, I'm fine. Prostate cancer, symptomatic prostate cancer, is a sign of either very locally extensive disease or metastatic disease. So be mindful of that. It's a silent killer. 30,000 men are going to die from prostate cancer this year. So getting tested early and having regular follow-up, I think, is very important. PSA, we've gone away from looking at a minimum level of PSA. We don't say your PSA is elevated anymore. I look at PSA as a change in PSA over time. That's the important way to look at this. If your PSA is always 8, it's always 8, and there's no reason to biopsy your prostate. If you go from 1 to 3 to 7 to 12, that's a problem. So be mindful of that issue. Benign prostatic disease, urgency, frequency, incomplete emptying, nighttime urination, all those bothersome things. We've got a lot of options for patients, from lifestyle change to medications to procedures that can be done that are relatively straightforward and simple. So don't be afraid to talk to your physician about urinary issues with prostate disease. So, bottom line, it's nice to have a group of people at Holland Hospital, and I mean the physicians and all the other people that support us. Men's health is incredibly important. We're all about wellness and prevention. We're not just about treating disease. So regular screenings, regular checkups, do the things you need to do to keep yourself healthy. I really appreciate Holland Hospital putting on this. It's a good thing. It's a good thing for the community. So thank you guys for coming. Matt is the marketing expert, but he's actually a comedian, right? Matt's going to take you through some other stuff, and we'll go from there. Thank you guys for coming.